We've got a Neanderthal who survived a forearm amputation 40,000 years before anesthesia existed. We've got a skull from Peru that shows better survival odds than actual Civil War battlefield surgery, and we've got a Chinese physician who was knocking patients out cold 1600 years before it was even a concept. These are 10 cases where ancient people did things to the human body that, on paper, should not have worked, and somehow they did. Let's get into it. This one genuinely rewrites the history of medicine. Archaeologists found a skeleton roughly 31,000 years old, missing part of its lower left leg. Not lost in an accident and left to die, the bone shows clean healing. Someone amputated that limb, kept this person alive throughout the recovery, and they lived for years afterward. This is currently the oldest known successful surgical amputation on Earth. Before this discovery, the assumption was that complex surgery, dealing with blood loss, infection, actual survival, didn't show up until we had agriculture and settled societies, like maybe 10,000 years ago. This pushes it back over 3 times that far into hunter-gatherers with stone tools. It is said that whoever performed this had to understand anatomy, infection risk, and post-op care well enough to pull it off. I don't know how you learn that without a few failures first, and that's a thought I'm choosing not to sit with for too long. This text, credited to the physician Sushruta around 600 BCE, describes rhinoplasty, literally reconstructive nose surgery, using skin grafts taken from the patient's own forehead. It also details cataract surgery techniques using a curved needle to dislodge the clouded lens. These aren't vague, mystical descriptions either. They're detailed, procedural, step-by-step, and some of these exact techniques are still referenced by plastic surgeons today when discussing the history of reconstructive surgery. Sushruta is sometimes called the father of surgery for a reason, and it's honestly wild that a 2,600-year-old medical text holds up as functionally accurate. Apparently, ancient doctors were just built different. Trepanation, that's drilling or cutting a hole into the skull. It sounds like a horror movie premise. Pretty sure they did this in like a parking garage or something on Grey's Anatomy, but ancient Peruvians did this constantly for headaches, skull fractures, even to relieve pressure from head trauma. What's wild is the survival rate. Researchers looked at skulls across different time periods and found survival rates improved dramatically over centuries, with later Inca-era skulls showing survival rates estimated as high as 80 to 90% based on visible bone regrowth around the surgical site. For comparison, Civil War-era battlefield trepanation with actual metal tools and germ theory just barely emerging had survival rates closer to 50%. Somehow, people cutting into skulls with obsidian tools centuries earlier were doing it better. Apparently, practice really does make perfect, even in the worst possible category. This is a Neolithic farmer found in France who had his forearm surgically removed nearly 6,900 years ago. What makes this one stand out from some of the older cases is the precision. The bone shows a clean, deliberate cut consistent with an actual surgical procedure rather than a battlefield injury or an animal attack. He survived the amputation and lived for years afterward, farming and functioning in his community with a prosthetic-style covering over the stump, based on wear patterns researchers found. This is one of the earliest examples we have of what looks like genuine surgical intent, not just stop the bleeding, but let's actually remove this correctly, which means somebody in a farming village 6,000 years before we had the concept of a hospital had functionally figured out amputation technique on their own. At the Krapina site in Croatia, researchers found teeth roughly 59,000 years old showing what looks like deliberate drilling marks believed to be an attempt to relieve pain or infection inside the tooth, using a stone tool on a live patient with zero anesthesia. I mean, imagine being the test subject for that. There was no going back and saying, actually, maybe let's not do that. Some researchers debate whether this was true dental intervention or just wear patterns from something else entirely, so this one does come with some scientific disagreement attached. But if it's real, it's one of the earliest known examples of dental surgery on the planet, performed by a species we spent decades assuming couldn't plan that far ahead. This is the oldest known surgical text in human history, dating to around 1,600 BCE, though it's believed to be a copy of something even older. It reads, almost like a modern medical manual. Case after case laid out with symptoms, examination steps, diagnosis, and treatment. And here's the detail that really gets me every time. It contains the first known clinical description of the human brain, including cases where physicians recognized that a head injury on one side of the skull caused symptoms on the opposite side of the body. That is a real neurological observation made in ancient Egypt thousands of years before anyone understood what a nervous system actually was. This is a Neanderthal skeleton found in a cave in Iraq, and this guy, he went through it. He was missing most of one forearm, blind in one eye from an old injury, had hearing loss, and showed signs of a limp from a leg injury. By any modern standard, he shouldn't have been able to hunt, defend himself, or keep up with a group. And yet, he lived into what would have been considered old age for a Neanderthal, probably the 40s, which is genuinely elderly for that time period. That means someone was caring for him, feeding him, protecting him, for years. This isn't really a surgery story so much as an aftercare story, proof that Neanderthals weren't the brutish loners we used to picture them as. Apparently, they had actual social structures built around keeping their injured alive. Isn't that kind of beautiful in the middle of something this old and grim? Across Mesoamerica, archaeologists have found skulls with small precision-cut holes drilled directly into living teeth with gemstones like jade, turquoise, and even hematite set inside them. This wasn't decoration slapped on after death. The wear patterns and healing around the tooth prove this was done to living people, and they kept using those teeth normally afterward. Using a hollow bamboo or bone drill spun by hand with an abrasive-like ground quartz, someone drilled through solid enamel, the hardest substance in the human body, without hitting the nerve, without causing infection, and without modern anesthesia. That level of precision done by hand on a conscious patient. I will pass on that, thank you so much though. But respect where it's due. Hua Tuo was a physician in ancient China around 200 CE, and historical records credit him with developing an herbal anesthetic, believed to include ingredients like datura and possibly cannabis that could render a patient fully unconscious for major surgery. We're talking abdominal surgery, documented in historical texts as being performed on patients who felt nothing and woke up afterwards. That's roughly 1,600 years before ether was used in Western medicine. The exact formula was reportedly lost to history. Some accounts even claim that he burned his own medical writings before his death, which, if true, is one of the most devastating losses in the history of medicine. We got so close to having that recipe. So close. Roman surgical kits found in Pompeii. When Mount Vesuvius buried the city in 79 CE, it perfectly preserved an entire physician's home and workspace, now literally nicknamed the House of the Surgeon. Inside, archaeologists found full toolkits, scalpels, forceps, hooks, catheters, even specialized gynecological and obstetric instruments. Some of these tools are so refined that similar designs were still being used in European medicine over 1,000 years later. This wasn't a lone genius working in isolation. This was a standardized profession with mass-produced medical instruments, meaning there was an entire supply chain and training system behind Roman surgery. Isn't that wild? A volcano froze an entire operating room in time, and it looks disturbingly close to something you'd find in a modern doctor's office. Alright guys, that has been our list for today. Thanks so much for checking it out. I've been your host today, Olivia Kozlowski, and I will see you again soon. Bye!